Good afternoon. I'm going to start with a video. Could I have the lights down, please?
Rather than thinking about the firm, think about educating and teaching. The knowledge you provide will bring us back. Eventually, it will bring you patients who trust you. You can make local applications to help educate patients on the importance of emergency care and also the pre- and post-surgical steps they need today.
By developing websites that take care of online registration and appointments, you help save valuable time, which reduces your overall costs and also makes patient care better.
You might be earning okay, but by proactively investing in technology for the long term, you will eventually over time see major earning climbs. Be patient, be ethical and honest. You are also reducing other costs through these investments, which will reduce the overall expenses and allow you to increase income through ethical means. By having a website with information and a contact form, you are saving paper and additional employee costs who would have been used for providing lesser information at high cost. Dialing your doctor needs to be quick. Help your patients reach out to you faster. Being present on social media to help educate and serve people through honest and ethical knowledge will only help improve your brand and value as a doctor. Patients will trust you.
Telemedicine and even other online methods to communicate with your patients will effectively bring down both yours and their overall costs, making it more productive.
Using online medical software will allow you to track your patients and keep track of their vitals even while they are not there. Web health trackers will help significantly. Creating healthcare networks will help refer patients to the right doctors too. These can always be made on the internet. Imagine a patient diagnosed with heart disease. If the doctor is in touch with a senior cardiologist, sending the patient to the right doctor could save his or her life. Similarly, when a patient asks a cardiologist for treatment for diabetes, he or she could be referred to a senior D-based specialist for treatment. The list goes on. Remember, we are talking about honest referrals to competent doctors and not about cuts and commissions. Ethics is very important. Doctors should never try to get patients to come to them through self-promotion. Let patient testimonials from the internet and word of mouth do that. Avoid portals who ask for money to bring your name to the top of the doctor search page. This does not help the patient in any way. Focus on patient testimonials and real reviews. Always remember that patient care should come first. The internet should be used to help educate patients. The knowledge they get will eventually help you earn ethically.
So never forget the ethical code of conduct of doctors. Now, this is very difficult in a time where people are trying to use the internet for their own personal needs and requirements. Now, I think I'm going to lose a couple of seconds because my presentation is fairly large in size, but not in slides. So till then, how many of you have websites? You can turn the lights on, please. On, not off. All of them, not some of them. And I need someone to help me make my presentation. Oh, there we go. Now I'm having another problem here. My presentation is not running. Can someone from IT help me? Okay. Okay. No, I know it, but it wasn't working. It's very slow. So this is a little bit about me. You can read it. I'm not going to talk about myself because I have just about 10 minutes left. I am not a lawyer, though I recently heard one of the previous speakers' father was a lawyer. I've tried to understand the MCI guidelines to the best of my knowledge, but I am not a lawyer, so always consult MCI for clarity. Everyone talks about having a website, but no one really talks about what's allowed, what's not allowed. Now, before I get into that, why do you even need a website? And for that matter, why do you even need to think about earning online? Well, the answer to that is this. Youth, youngsters who have technology, who challenge doctors. These are people who have cell phones, tablets, PCs, access to Google, where there's plenty of information, out of which, as Dr. Vinith said, plenty of irrelevant, wrong information that confuses patients, eventually leads to patients asking for second and third opinions. And this is not going to change. And this is something that doctors have to accept. The younger they are, the more they're going to challenge you. They're going to have doubts. If you tell them that they need an angiography, they're going to ask why, and you have to explain it properly. Sometimes you might end up meeting a patient who really disturbs you, but that's something that you will have to deal with. And that's why you need to change for the better, and your focus on earning ethically should not be about money. Yes, the long-term goal eventually will be money, but it should be initially about earning respect and trust of the younger generation. So what can you do? First of all, I recommend you should be educating the mass. In the last 45 minutes, people have been talking about providing information on websites in Gujarati, Hindi, Tamil, etc., etc. That's absolutely right. Now the question is, why can't you stand up and say, we're going to do it on our website, and we're going to tell patients to come to our websites rather than having them do a Google search and then complaining about it. Secondly, focus on collaboration. There's so many of you who know each other, and I'm not talking about commissions. We're talking about honest, ethical practices and transfer of patients. So if I was a cardiologist, I'm not, but I did know someone who was a diabetes specialist, and I had a patient, I would prefer to recommend them to the best and not to someone who gives me a commission. This is one of the unfortunate, sorry states of India where we still rely on commissions. We need to get rid of that. You should have an online website, you should have an online presence, and rather than talking about yourself on your social platform or website, you should let patients talk about you. There's something called Google Reviews. Use it. Develop mobile applications. Almost each citizen of our country has at least one or more mobile phones. Now, some of you might say, what about rural people in villages? Surprisingly, research comes out that most people in rural also have a mobile phone. Avoid advertising on websites and web portals which ask you to pay more to get to the top. That's unethical. And web portals should stop doing that as well. Now just imagine this. A young doctor who just barely passed through medical school, not very bright, but his father is a rich guy, says, here's your inheritance, here's lots of money, do whatever you want. Visit someone from Just Dial or another health company portal, don't want to give names here, they're sponsors, but I needed a laugh here, all right. Don't pay them more money to get to the top because that's risking your patient. Websites should have content about diseases, not about you. Explain what diseases are there, what could happen, but provide genuine information and not information that eventually redirects them to you. If you can do this and if you can be honest, and most importantly, if you can look at the MCI guidelines and follow them, and they're very difficult to follow. A lot of people keep asking, a lot of doctors keep complaining, MCI doesn't allow this, it doesn't allow this. Well, if you actually read through it, MCI guidelines do mention certain things you can do. So the MCI guidelines does mention that you can provide diagrams and knowledge to patients. You can do public seminars as long as you are not self-promoting, so that's providing knowledge. Eventually, all of that allows patients to trust you, people to trust you. People who trust you are eventually going to come to you. So don't be scared about providing information. Now, there was a topic about telemedicine, and that's another tricky area. Telemedicine is a great way to earn, but there are loopholes in our country. One, MCI guidelines does not have clarity about it. There is the IT Act of India that comes into picture. But more importantly, and I don't believe anyone mentioned it, it does fall under the World Health Organization rules. So go through those. Ethical ways of earning money in a long run through knowledge includes development of websites that provide knowledge, recommending other good doctors. Sometimes a patient might ask, I've got a fever, what should I do?
Last 3 minutes, sir.
That's fine, should be done. And your reply should be, not come to me for a visit, but talk to your family physician. Someone did mention earlier that a doctor should be a teacher, and take that online now. You can have mobile apps. Social media is a great way to provide information. It doesn't just need to be about your field. It can be simple things like what to eat, what not to eat. A lot of people have a complaint that there are very few mobile apps for pregnancies which explain what pregnant women can eat. A lot of people in Gujarat have been complaining that when they see international apps, it says, eat fish, eat meat, eat cow meat. Now in Gujarat and India, you can't do that. So develop apps that provide information. The do's and don'ts are very clear. Recommend family physicians, follow MCI guidelines. What not to do is also obvious, but you need to push that in because I know a lot of people say, we know what not to do, but we still want to do it. Telemedicine is good. I'm now just repeating things all over again just to put it into your mind. Delivering public lectures is fine. Printing of sketches, diagrams, pictures, fine. Give talks on radios about education and knowledge, that's okay. Remember, don't use that for self-advertisement or promotion. Avoid referrals for commissions, the biggest problem in this country. A good branding strategy for doctors is setting up a goal, helping patients, pushing your identity through knowledge, following ethical processes, and again, always remembering you have a code of conduct which you must as doctors follow. Now, if you ask, what should I do in my mobile app? Share knowledge, share information, help it book appointments for your patients. Keep sharing regular updates. The website, same way. Book appointments, information about diseases, provide fee structures. That's part of the MCI guidelines allowance. Again, be ethical. Do what is right. Even if everyone is doing what is wrong, you need to do what is right. And that will eventually make you different from others and bring you to the top. And obviously, my last 10 seconds. Don't believe anything and everything you get when you search Googling. how to earn money on the internet part-time. Otherwise, you'll end up with the stock market and you'll end up losing more than you earn. Thank you.
Thank you, Mr. Shivam.